It's really easy for me to, tell you how I've been personally impacted by this. But I think the real issue here is that the work I did impacted a lot of people in rural areas who have, you know, community issues with substance use. And there are tons of us that were working with people who really need these services. And when you have federal support that can, directly support these local efforts, I think you have better outcomes long term. So I was a project officer within the Division of Overdose Prevention. I worked in the Drug Free Communities branch. And in that job, I worked directly with community coalitions. My coalitions were out west, and I worked directly with those folks to help their youth substance use prevention efforts. So I think the problem with firing me and four of my other coworkers um, is that now these communities have less support. They already don't get a lot of money. Without the free support that they were getting from project officers and from CDC, they're going to have to use that money to hire contractors, to find people to fill those knowledge gaps that they're going to have because CDC is not there to appropriately support them. The ultimate result of that, right, is that prevention isn't as effective as it could be, which means you could see an uptick in alcohol use among youth or tobacco use among youth, which we've worked really hard to bring down. And in some communities, that could look like an increase in opioid use. And that's after we've had 2 years of a decline in overdoses. Overall, the public health field has to exist. It is a requirement for a functioning society. I think that most of us know that. I was reinstated, but I'm on administrative leave. So, and that's for everybody who's been fired from CDC. We've all been put back on administrative leave, which essentially means we're not allowed to do our work. We're not allowed to transition our work to other people. And they're just continuing to pay us while the courts work through kind of whether or not we were illegally fired. We will fill in the gaps while we have to. And my hope is that eventually we'll all really get to be able to get back to work and really accomplish some of these core missions of public health in the long term.